Hi there. Welcome to a short informational video on explaining neuromuscular pain drivers. If you're watching this, it's because one of your therapists at MTS has decided that you might benefit from the information here based on what you might be presenting in the clinic with. So just going to bring you through a few tidbits of information to help kind of clarify the course of care that you might be receiving from your respective therapist at MTS. So if we look at the categories of symptom onset or areas where some of your symptoms might be residing from and the drivers of those symptoms, what we can really basically break things down into 5 potential categories. One is that there's an inflammatory setting, in that the system's really inflamed. The mechanical driver would be anything like decreased range of motion or a joint or a piece of soft tissue that's not moving as well as it could. Motor control is how well the body moves and coordinates itself through movement or exercise. And loading tolerance is how strong or how conditioned one is to receive the amount of load associated with the activity that we're trying to address within your course of care. But today we're really going to be focusing on this neuromuscular pillar, and we're going to describe what that is. And it's one of the pillars that, as physical therapists, we find tends to go missed the most. So it's important that we have a clear definition for you and for us as we move forward through your course of care. So just focusing on that today. So what is a well-functioning neuromuscular system? If we break down the words neuromuscular, it's really the interface between how well our nervous system, the nerves of our body coordinate with the muscles, the functional unit that helps move our body. So when that system is working well together, we find that there's a sense of synergy, a sense of coordination, appropriate timing for the amount of activity that we're doing. And there's a sense of support when it comes to our function or activity. So if we look at the picture on the right, we see our shoulder joint and a bunch of muscles working together to help create elevation of the shoulder. And it's that timing and that coordination of those muscles and how well they're able to balance with one another that dictates smooth and effective motion. Sometimes when some of those muscles don't turn on or work effectively, because it might be what we call inhibited, that arc of movement becomes compensatory or problematic. So we'll look at that here in a second. So again, we have this picture on the left that we just saw, as well as this new picture on the right. Both are showing how different regions of the body can be coordinated with one another. So on the left, we're seeing how muscles might work together at an isolated region, like the shoulder. But on the right, we see this line of dots, and those are coordination points that we might be working on in your course of care, as all of those muscles work with one another to help with upper arm, in this case, upper arm movement. Sometimes the way I describe it to my patients is that each one of these dots is like stops on the Metro North line. And if one of those stations is out of commission, there becomes a little bit of congestion on how well the train runs from point A to point B. So at any point in your course of care, if you're having problems at an elbow or a shoulder or even the neck, we might be looking at these other points because of this neuromuscular connection that we're trying to reestablish. So if we look at things more simply, two very easy pictures here to see is one on the left is that all of the players or all of the little people are helping lift this rock, and when everyone's pulling their own weight, the rock becomes lighter in a sense, and an ability to lift. This is synonymous with the idea that when all of our muscles are working well together, the load becomes lighter, and whether it's hitting a tennis ball or swinging a golf club, those muscles are able to create a force output that is more effective. However, on the picture on the right, where you have some of these muscles, or in this case, some of these stick figures, are out of commission, and therefore the ability to lift that rock becomes unavailable. So over time, when our neuromuscular system goes through a point of compensation, some of these muscles, for whatever reason, might go offline, and as a result, the forces that we're trying to resist in our daily life become more challenging. So it's important that we try to get all the players back in the game. So how can we help? What are we going to be focusing on in your course of care? The biggest thing that we need to address is screening and diagnosis. Where are the issues residing, either on the line in respect to adjacent regions or within one region itself? And your therapist is going to be working on trying to identify what muscles are on, what muscles are quote unquote off, and how we're going to be focusing our attention to help re-educate the system. So with manual therapy, we can start to provide some input into the system, reduce the amount of congestion in our soft tissues, provide input into the nervous system itself with hands-on pressure, reducing some of the tension and tightness in the muscles so that there becomes a better connection for the muscles that are not available to us at any given point. So manual therapy can help reestablish that connection. This is followed up with neuromuscular re-education, so making sure that the body kind of knows how to fire those muscles again once they're no longer dormant. And that can be done through either hands-on pressure from the therapist, or it can be done through targeted exercise with specific cueing for getting specific areas to help fire the best that they can. And then we always try to reinforce what we were working on in the clinic, so that between visits you have something that is directing you to firing those muscles, getting the brain getting the brain back online and helping it find the connection back to those regions that we're focusing most on, so that we can take a step forward in our next session. So, just that sequence of things has been proven to be effective for repetitive injuries or things that don't just respond to hands-on pressure itself. So the end goal here is that we help restore a sense of balance and synergy to our system as a whole. That with that synergy, we reduce the amount of aberrant stress or force on the body, because all of those players are working together. And we can then gradually progress your strength with those players online, so that we can move towards full activity restoration and just full participation in whatever it is that's important to you. So just to illustrate that, picture on the right just showing a bunch of happy muscles all working together so that they can, in this case, move that shoulder. If you have questions on this, feel free to ask any of the therapists here at MTS. My name is Alex Blank, and I hope you found this helpful.